How are you, my people? This is Samuel Sane here at Glen Eagles, and I have a new friend here in Mumbai, our great doctor, a neurosurgeon. And I want him to say his name and tell you what he does for so many years. Doctor, you're welcome to say hi to my
Yeah,
people and
hi,
introduce yourself.
I'm Dr. Nitin Dange, Director of Neurosurgery as well as Interventional Neurology at the Glen Eagles Hospital, Parel, Mumbai, India. I am a hybrid neurosurgeon wherein we deal with patients of brain, spine, and stroke. Friends, we have solution for all the brain and spine problems at our hospital at Glen Eagles Hospital, Paril, Mumbai, India. Whatever may be the problem of brain and spine, which needs surgical treatment or medical treatment, we are all experienced and we offer international standards to the best for the patient care, patient centric, and the best outcomes in the world. So, for that matter, just to enlist what we do, we take care of the brain tumors, we address trauma, neurotrauma, we address spine problems, right from degenerative spine, spine tumors, spine trauma, then pediatric neurosurgery, then epilepsy surgery, then interventional neurosurgery, wherein we operate for the vascular problems, both combined open surgery, conventional, as well as endovascular, which is our forte. So, we are the most experienced hybrid neurosurgeons in the country, and we have operated more than 5,000 cases altogether, brain and spine.
Wow, that is great. 5,000 cases. Doctor, for how long have you been practicing neurosurgeon
So I've been
specialty?
practicing neurosurgery exactly now 20 years. That's from 2005.
2005, up to date.
Yes.
What inspired you to do this specialty of
Yes,
neurosurgery?
exactly. So from the time we started our medical school, I was always fascinated by the nervous system, brain, and spine. So I was motivated, inspired since then because during my medical school and graduation, I was always the topper in the CNS. I was always fascinated and very well impressed by the system brain and spine. And all we all know that brain and spine is the supreme structures in the body which controls whole of the body. The brain controls, we all know, the heart and rest of the systems of the body. So I feel brain and spine is the most challenging, and I always like to accept challenges in life.
Wow, that is good. Thumbs up for you, doctor. You have
Thank
done.
you.
I have followed your case and I understand. And you have come a long way treating people of brain and spine.
Absolutely.
Doctor, tell us, what do you have managed to do before?
Yes.
Tell us.
So right from our forte is we have the maximum experience in the public hospital where we used to get all sorts of complex and complicated cases. That exposure, experience, and the outcomes which we always thrive for, the challenges which we experience and the satisfaction which we get after treating complex cases, whether it is largest brain tumors in the world, whether it is largest vascular problems like AVM in the world, whether it is largest aneurysms which are complex in the world, the skull-based surgeries which are complex brain tumors, which is the most challenging and has lots of morbidity and mortality. Such patients which we operated multiple times, not single but multiple such cases with best outcomes in the world, has given us an upper edge to deliver best outcomes, best results, and quality care.
Wow. Doctor, you said about you do epilepsy surgery. What do you mean by this?
Yes. So there are patients who are having chronic epilepsy for long term, and there are select patients wherein the brain, the epileptic fit attacks originate from a part of brain which is scarred. The scarred brain, which is unwanted, which is not functional, and gives rise to impulses or activity of unwanted, which gives rise to fits or seizures, can be operated and removed without causing any functional or damage to the patient. And that can give rise to cure. But it is not for all 100% epilepsy patient. We have to select, we have to do the investigation like a special MRI for epilepsy protocol and then video EEG and confirm the focus,
Yes.
which can be with operation removed from the brain, and patient can live fit free life.
Wow. Without medication.
Without medication.
Great.
Yes.
And what about the tumors?
Yes. So brain tumors, as we all know, there are two types of brain tumors. One are benign tumors, which are non-cancerous, and there are cancerous tumors, which has even today in the world not much research or not much conquer of the outcomes has been done. But the benign tumors, which are also very common, like meningiomas, acoustic neuronomas, complex skull-based tumors, and other types of tumors which are non-cancerous, can be treated and cured from with good surgery, with a good infrastructure. And we also are always technologically advanced, so we integrate AI to have better outcomes. Right from diagnosis, where the AI is integrated, gives us better picture, better understanding, better anatomical knowledge, information about the brain and the pathologies. That helps us to give or deliver better outcomes.
Oh,
So we have to be at par with the technology, and as I had said, brain and spine is a complex organ of the body. So we need to integrate and take help of complex tools, newer tools, which will help us
yes.
to have better outcomes.
Great.
So we have to always be updated, have our armamentarium with good quality and latest technology, state of the art technology. So we have in our hospital at Glen Eagles the state of the art biplane cath lab, wherein we do endovascular neurosurgery for vascular problems of the brain and spine like AVM, aneurysm, stroke, stenosis, and then acute stroke, which is the new thing where we these patients with large vessel occlusion or blockages. We take these patients to the cath lab within the golden window period, remove the clot, and we cure them from the strokes or paralysis.
Yes.
So these are all new things which are which we have, and we are experienced in all types of things,
yes.
in vast numbers. And that's our what we call say forte, our what we call advantages being a hybrid neurosurgeon.
Yes.
And we have solutions for all the problems under one roof,
yes.
being hybrid neurosurgeons.
Doctor, thank you so much for the updates.
Yes.
We are behind the news.
Pleasure meeting you.
Yeah, no. A serious question.
Yes.
Look, there is this case of cerebral palsy.
Yes.
Do you treat this?
Cerebral palsy most of the time is a situation or a problem or a disease which is presents with deficits which are all congenital. So whatever are the deficits or what we call as disabilities are mainly corrected by orthopedics, plastic surgery,
Yes.
and as we say, these are palsies.
Yes.
It originates from the brain, but the brain is already underdeveloped or has some problems with the development.
Yes.
So there it is difficult to fix those problems. Maybe in the future with
Yes.
AI, we may add brain computer interface. Very soon that's going to come.
Yes.
And definitely it may help cerebral palsy patients.
Well, that's
But,
great.
yeah.
Doctor, you again, let me take you back to brain tumor.
Yeah.
You said about cancerous and uncancerous. Yeah. How do you go about cancerous tumor?
Yes.
Yes.
So there are two types of cancerous tumors, what we call as gliomas, which are two types. One is the low-grade gliomas and the high-grade gliomas.
Yes.
So these are primary brain tumors which originate from the brain cells itself, and they are quite aggressive tumors, especially. But if you detect these gliomas, tumors early, like in the low grade, we can completely excise them with the availability of technology and infrastructure at our center.
Yes.
The best quality microscopes, micro neurosurgical experience, the tools what we use, AI integration, best quality neuroimaging, and the skills when we integrate together and a comprehensive tailor-made approaches for the patients, low-grade gliomas can be cured with surgery.
Surgery.
Okay? Yes. Of course, the higher grade gliomas like the glioblastoma multiforme, even today in the world, there is no much long-term solutions or cure, but we can definitely operate on them and give good quality of life for whatever people survive.
So the earlier the detection,
Yes.
it saves lives.
Absolutely.
Thank you. Doctor, there is this disease known as multiple sclerosis.
Yes.
What is it?
So basically, it is a disease which causes scarring of the brain and the spine tissues, and it is due to, as the name says, sclerosis. Sclerosis means scarring, and multiple mean at multiple places. So it's a degenerative disease which has no known reasons. It is idiopathic. It can occur to anybody, and as I said, degenerative. So there are hardly any surgical options in these patients.
Yes.
It is a medically treatable condition, and this degeneration, which occurs at spaces forming of plaques, what we call,
Yes.
in the parts of the brain and spine, that with the acute episodes, patients presenting with multiple sclerosis, it's a long-standing disease which has no cure. And whenever there is acute exacerbation of symptoms, what we do is we manage medically by giving immunosuppressant, either acutely like IVIG or steroids, and chronically we give immunosuppressants so that the attacks are less and patients have good quality of life. So basically, it is a medically treatable degenerative or autoimmune disease which can affect your brain and spine, and it is always a long standing and non curable disease.
Good, thank you for the advice. Doctor, people complain so much about nerves, and this is in your field,
Yes.
about central nervous system. What can you tell them about nerves and what, when they have a condition related to nerves, how can
So
you
peripheral nerves, of course, is a part of the central of the nervous system. So there are two types as we divide nervous system in central nervous system, which is brain and spine, and the nerves which exit from the either brain and the spine. That's the peripheral nerve system. Now, so the nerves which exit from the brain, they are called as cranial nerves. These are 12 cranial nerves, and then the spinal nerves which exit from the spinal cord. These are the peripheral nerves which has its own problems, right from congenital. Then we have inflammatory problems like infections, inflammation, swelling of the nerves, and then we have degenerative because of the spine issues. These nerves can get compressed, and one of the most important what we call is a brachial plexus injury, wherein due to trauma, the nerves exiting from the cervical spine, which control the hand or the upper limb, they can undergo trauma and stretch, and which needs what we call as a repair. And that too, if done in time, it has good outcomes.
Yes.
While the peripheral nerves at the lower limb, where basically the spinal problems compression can be occurring at the spinal cord, can be treated by spine surgeries.
Yes.
And if there are tumors in the nerves, we can excise the tumors with our advent or new technology.
Yes.
Microneurosurgery.
Microneurosurgery. Good. Doctor, is there any nerve implantation?
So basically, we as I just mentioned, when there is a damage to a part of the nerve, undergoes degeneration, scarring, and that part becomes non-functional.
Yes.
So we implant the nerves which are like pectoral nerves, nerves from the periphery, and we do a bypass there. And that's called as a nerve repair. And we can do multiple nerve repairs where there is damaged non-functional nerves, and we can reconstruct the nerves post-trauma or post-surgery if you want to excise the part of the nerve. Like acoustic nerves, we do bypass or grafting. So that can be also a surgical, what we call modality of treatment,
Yes.
to have good functional outcomes of the peripheral nerves.
That gives hope.
Yes.
For example, a patient encountered a certain tragic road accident and actually got a problem with the spine, and the nerves were damaged. So you can fix that.
So basically, post-traumatic spinal cord injury is a very complex situation. The outcomes are usually very bad because, as we all know, the nervous system does not have regeneration capacity, and the spinal cord is very sensitive, especially the thoracic cord, which controls the lower half of the body as well as the power in the lower part of the thorax. And if it is damaged, if there is a persistent compression, and we can treat those patients within first few hours,
Yes.
remove the compression, fix the fracture, then the outcomes are good.
Yes.
But the cervical spinal cord injury has very not very satisfactory outcomes. If there is an injury prima facie to the cord, because it is a very sensitive organ and it controls your breathing as well as lower all the four limbs,
Yes.
power as well as sensation as well as your bowel bladder. So these are the situations which are better prevented.
Yes.
The injury is prevented rather than cured.
So good. Is there any brain transplantation?
Yeah, not at, and hopefully we are looking, as I just mentioned,
Yeah.
brain-computer interface, which may take some part of the function, which we are already in having. We are undergoing some trials,
Yes.
and that can replace some part of the brain as a AI integrated technology, and may help us to control paralyzed patients to have movements or sensation.
Yes. My last question goes to stroke patients. Can you treat stroke patients?
Absolutely. It's very nice question, and that's the need of the hour. One have to have awareness. So acute stroke are of two types.
Yes.
One is a hemorrhagic stroke, which is less common, about 20%, while 75 to 80% of the strokes are ischemic stroke. Now, ischemic stroke means there is a blockage or clot inside the artery which supplies the brain.
Yes.
And the blockage, beyond the blockage, the brain doesn't receive circulation, oxygen, or blood, and it starts dying.
Yes.
So this is the situation which needs to be addressed, and time is of essence in such situation.
Yes.
So acute ischemic stroke we call be fast. Whenever somebody develops symptoms of acute stroke, we remember that as B fast. B stands for balance, loss of balance. E stands for eye signs, sudden loss of vision in one eye or both eyes. F stands for face asymmetry. A stands for arm weakness. S stands for speech difficulty.
Yes.
And if this B fast is there, the time T for time, you have to rush these patients to the nearby stroke ready center. Now, a stroke ready center is a center like us, which has infrastructure of CT scan, MRI, and experts of team like neurologist and interventional neurosurgeon like us, who can go mechanically. And first is we give injection within the first 4.5 hours.
Yes.
To dissolve the clot, and if there is a big clot, we take these patients to our cath lab.
Yeah.
And go from the thigh and remove with the different types of hardwares.
Yes.
Like aspiration, suction, or stent retriever, the mechanical clot removal.
Yes.
That is called as mechanical thrombectomy. We open up the vessel, and if it is done within first few hours, patient can go back to home normal without any paralysis.
Wow, that is good. What about when there is a delay?
So if there is a delay, now that extended window period is up to 24 hours. So if you have delay in acute ischemic stroke more than 24 hours, we hardly can do anything. But the most important thing, depending on the type of stroke, severity of the stroke, one can start blood thinners as well as rehab program. So we also need a good rehab program, which we have in our setup.
Wow, that is great, doctor. Now, what do you have to tell my fellow Kenyans and also Africans back in Africa? Tell them what you wish.
Neurosciences, as I say, brain and spine problems are curable.
Yes.
If diagnosed early, and with the experience as well as the technological integration, comprehension.
Yes.
It is in today's world, most of the problems, most of the challenging situations, with most of the complex problems as well as simple, can be treated, and if done within time, can be cured.
Yes.
So friends, time is of essence in majority of the brain and spine problems. Don't neglect your symptoms, which may be subtle, which may be initially beginning mild symptoms neurological. Please get yourself evaluated, investigated, and consult the experts so that you don't miss on time and you don't have a permanent problem.
Wow. Doctor, I like inspiring young men and women who wish to be doctors like you. What
Thank
do you
you.
have to tell them? They
Young-
wish to be doctors like you.
So
Please advise them.
we need healthcare experts. We need, see, as we all know, life comes with medical problems. Body has to have some health related issues. So we need good experienced, dedicated, sincere, hardworking doctors. So it is a service to humankind. It is a service to mankind, and doing good healthcare services, whether it is a medical, whether it is surgical, and especially subspecialized services like which we are blessed to have skilled and experience in neurosciences, brain and spine surgeries with stroke experience for treatment in the stroke care. We always feel blessed, and one should be really looking forward to taking this specialty of treating ill patients and making them at ease, this ease to ease. So that's what I feel, and that's the best satisfaction in life one can get.
Wow, thank you so much. We appreciate and hoping to see you in Kenya.
Definitely. It
Please
will be our
come.
pleasure.
You talk to your people.
Yes, we look forward.
Thank you so much. I appreciate. Thank you so much.
Nature.